my nursing friends, how are you? Hope you are doing well. In our last video, we have learned about adrenal hormones. It's a naturally occurring hormone as works as a neurotransmitter and it's released from adrenal gland. It works as a receptor, adrenal receptor. If you have not seen this video link is available in description box. Let's have a quick recap. All adrenal it works on adrenal receptor alpha 1 and beta. Alpha has alpha 1 and alpha 2. Beta has a beta 1, beta 2 and beta 3 subreceptors. Okay. So we can see heart has predominantly beta 1 receptor, lungs there is a beta 2 receptor, blood vessels there will be alpha 1 and beta 2, both the receptors. So one will help to increase the blood pressure, one will be vasodilator, so help to increase the blood flow. Liver alpha 1 and beta 2 both helps to increase the glucose level by gluconeogenesis. And lastly, adipose tissue which help to break down of fat to release more energy. Okay, so we can see heart present in beta 1 receptor, lungs it present beta 2, okay, which enhance the blood enhance the entrance of airflow. Blood vessels there is a alpha 1 and beta 2, one helps to vasodilation, one helps in vasoconstrictions. Liver there is a alpha 1 and beta 2 both the factor will help to increase glucose levels and breakdown of glucose. And lastly, adipose tissue which helps to break down of fat to release and produce more energy. Let's come to the very important part. What is the action of adrenal in a medical field? Comes to the medical use. So in medical use, we can very briefly tell A, B, C, D, E. A, anaphylactic shock. B is severe bronchospasm. C is cardiac arrest. D is dehydration leads to shock or hypovolemic shock. And lastly, effect or anesthesia drugs. Let's start one by one. So first function, it works on severe anaphylactic shock. Anaphylactic shock which may lead from any string bite, insect bite or any kind of food or drug allergy. In such cases, what will happen? There will be severe airway swelling. And there will be low blood pressure or blood flow and which leads to shock, that is called anaphylactic shock. How adrenal works in here? In such cases, the alpha 1 receptor, it will helps in bronchodilation. It will increase more airway opening, and beta 2 receptor, it helps to and vasodilatation. So when severe allergy happens, the airway swelling will be there. Then the alpha 1 receptor, which will be act on vasodilatation, it will improve the blood flow, and the beta 2 receptor, it will act on bronchodilation, which will act as a bronchodilation, which will be helps to open the airway and to enhance more airway, more airflow in our lungs. That's how it works as an anaphylactic shocks. And what is the dose? It will be 0.3 to 0.5 mg. In case of pediatric, the dose will be reduced, and our route is intramuscular. So dose 0.3 to 0.5 for adult. IM. Okay. Next come to the B. B is severe bronchospasm or asthma attack. So same way like beta 1 receptor, how it works as a bronchodilation, it helps in bronchodilation. Same way beta 1 receptor will help in more airflow, okay, in our air cavity, okay, and it will also increase the more minute volume. Okay, what is the dose? In such cases, dose will be 0.3 to 0.5 and mg. Route will be subcutaneous or IM. Okay, is that okay? Next comes to B. Very, very, very important. Cardiac arrest. Adrenaline is the first drug of choice in case of cardiac arrest scenario. It helps to increase blood flow as it works as a vasodilatation, alpha 1 and beta 2 receptor, as it works on alpha 1 both and beta 2 receptor. So beta 1, how it works? It will increase the heart rate on vessels. When it works, it will increase the blood flow, and when the constriction will be there, it will increase the blood pressure also. Okay, and alpha 1 vasoconstriction. In both the way, vasoconstriction, vasodilatation will be there. It will help in a act on cardiac arrest scenario. It is a first drug of choice. Dose is 1 ml is equal to 1 mg. You can repeat every 3 to 5 minutes interval, and there is no limitations. Okay. Route will be IV or IO axis, intravenous or intraocular axis. Okay. Next come to D. D is dehydration, or we can say shock, hypovolemic shock. As we have already discussed many times, when it helps as a vasodilator, so blood flow will be increased, it will increase blood pressure, and it in any way it will help to improve venous drainage, and it will increase the cardiac output. Okay, so you can use this drug in case of shock. Okay, in such cases, dose will be according to ICU protocol. IV infusion you can start and you can titrate according to the blood pressure. Come to the last one. Last part is effect on E. We can say effect on anesthesia drugs. Many one of you have seen that LOX 2% will be coming with the adrenaline injection. Why? Why and how it works? When the adrenaline, already I have discussed many times, so I have already explained many times, the adrenaline receptor, there is a acts on alpha 1, so vasoconstriction. So somewhere it will works as a vasoconstriction, somewhere it will work as a vasodilator. So constriction will be there, and if we use with the LOX 22%, then at the local anesthesia in that area, constriction will be there, so there will be more effect and it will persist maximum time. Okay, how it works? The dose is, it is 1:10,000 predominantly and or 1:20,000. This is the E. So I hope you can understand from this how it acts on the receptor and how we are using in our medical field. So very quickly recap: A, B, C, D. A, anaphylactic shock. B, bronchospasm or severe asthma attack. C, in cardiac arrest scenario. D, you can say severe dehydration or shock. And lastly, effect of anesthesia drugs. And quickly we will be finishing with the side effect. What could be the side effect? Side effect is palpitation, hypertension, then there might be palpitation, hypertension, it might be anxiety attack or tremors. Sometimes hyperglycemia. This is a very short side effect you can see in case of overdose of adrenaline. I hope you like, there is something you can learn from my videos. If you like it, please subscribe my channel and like my videos. Thank you.